that in all hereditary neurological illness, there are psychological manifestations, and most of them are in fact presenting by psychological and not neurological for some time. Let's take Huntington's chorea. Huntington's chorea is very highly comorbid with depression, but in fact depression precedes the manifestation of neurological symptoms in many cases. So whenever you have a family history of Huntington's chorea and you find that one of them is manifesting with depression, you may try to explain that as a coherent, logic way, that maybe he is depressed, he is afraid that he may get the disease, but in fact he is starting the process to get Huntington's chorea as a manifestations later on. Welsome disease, it's a problem of copper. And Welsome disease is very famous that you can put in all differential diagnosis because it can manifest itself by any neurological sign. But did you know that many Welsome disease do present with suicidal thoughts rather than neurological disorders and obsessive symptoms? So usually they manifest by obsessive symptoms and suicidal thoughts for some time before they develop a neurological deficit or involuntary movement. Acute intermittent porphyria, famous by the severe colics in the abdomen. But you know that in many cases, it presents with psychological manifestations. Anxiety, agitation, hallucination. And very frequently, they are confused as being hysterical. For many years, before a proper diagnosis is being made. Hereditary spastic paraparasis. This is a patient who is manifesting by bilateral pyramidal manifestations in lower limbs and scissoring gait and bilateral hemicircumduction gait in both legs. But do you know that hereditary spastic paraparasis is in fact presenting with psychological manifestations and not neurological manifestations some months or some years before manifestations, as anxiety, depression, or sometimes obsessive symptoms. The same for spinocerebellar atrophy and all kind of ataxias. Spinocerebellar atrophy, the most famous among them is the Friedreich ataxia. And all of them present with psychological manifestations sometime before presenting the neurological manifestations. Metachromatic leukodystrophy. Always remember that name because metachromatic leukodystrophy presents itself with a typical schizophrenia for many years before developing bilateral pyramidal. It's a very famous in neurology that this disorder does not present with bilateral pyramidal. It presents with schizophrenia, typical classical schizophrenia, with positive and negative symptoms of schizophrenia, and receive treatment for schizophrenia for many years, and then start to develop bilateral pyramidal. That can be missed for extrapyramidal rigidity. And that's why radiological examination is very important as the workout for patients who had no previous psychiatric history, and particularly if there is poor response to treatment.